Soroti Regional Referral Hospital serves about 2.5 million people from 10 districts in Teso region. And following the successful surgery on the Siamese twins last week, the health workers are now worried of how they will replicate that similar service to the next patient who may demand it due to the challenges they face, including the small size of their theatre and lack of equipment, among others. According to the team that conducted the surgery, the decision to take on the procedure was one they consider risky.
We needed things like cardiac monitoring, which we didn't have. We needed things which can monitor the internal temperatures of this baby to see that, because it's a young one, temperature is a very critical issue. We needed to have seen some other investigations done before this surgery, which were not there.
We also learned that the 2-bed theatre does not have equipment to manage critical cases.
The ICU here is not operational, it's not functional. Much as we have the equipment, we've not done the installation.
Our X-ray unit is down. It's very important. Some of the investigations like CT scan, other investigations that can be done in Kampala, in Mulago, we are not able to do here.
The X-ray machine we've been using is over 20 years old and it has outlived its use.
This was a child with a lot of metabolic derangements. And within our means here, we couldn't investigate all this, but we had to do the basics. You have to know what belongs to who in this operation and who takes what.
The team had to buy some drugs required to treat the baby post-surgery outside the facility.
We had to change to other very strong antibiotics, which we don't have in the hospital here, but we've made it a point that is bought and brought for the treatment of that baby.
As we took a walk around the facility, our camera captured this structure being demolished. We were told it used to be a ward. However, there is no sign to warn people off the site to prevent any danger from the destruction.
Quite a number of our facilities are dilapidated. They are quite old. When you go to our theatre, it's an old structure. It doesn't really meet some of the modern minimum requirements. But of course, it meets the minimum requirements for conducting surgery.
Dr. Mwanga says the hospital doesn't have some specialists.
Ideally, we should have 24. But right now, we have 12. We are training some nurses in Mulago, in critical care nursing for a period of 6 months. And we are hoping that when they come back, they should be able to support our ICU.
The hospital is also stuck with a pile of medical waste that needs to be disposed of. Currently, the facility's mortuary only accommodates 2 bodies at a time, creating an unending crisis as the fridge there has been out of service for 2 months now. Sources within the hospital say unclaimed bodies are now quickly buried in the public cemetery. The health sector in Uganda has the capacity to perform beyond the current output if some sticky issues like financing and human resource are adequately planned for and managed. Walter Mwesije, NTV.